Hello and welcome to the Psych to Practice podcast, your one stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm your host, Paul Wagner, and joining me as always is
Christner.
Yeah. And today we have a Masters in Practice episode focusing on a really important topic. And as you'll hear in the episode, maybe not a topic that's talked about enough. And it's really focusing on test anxiety. And we had the pleasure of talking to Dr. Ben Lovett, really talking about his recent book, Overcoming Test Anxiety. And just a wealth of information he has.
Just such an interesting episode for me, because I think that there were a few things that I think happen. One is some of the myths that we have about anxiety and performance, specifically in testing, maybe got dispelled a little bit.
Yeah.
And let's us kind of go, wait, maybe we're believing things that aren't there. But then moreover, just the number of different kind of suggestions of what we can do and what students can do to maybe empower themselves a little better during those test situations.
Absolutely. Really kind of once kind of maybe cutting through a bit of that veil, really then getting to a lot of actionable strategies. As you'll hear in the episode, whether that's from psychoeducation, whether it's some of the cognitive reframing or behavioral exercises, study exercises, really he talks about them all. And, again, all in one in his book here, Overcoming Test Anxiety.
Great book to read. And, again, then hearing him kind of just reinforce it was great.
And for those of you who maybe aren't familiar with Ben's career. So Dr. Ben Lovett is a professor of psychology and education at Columbia University's Teachers College, where his courses include psychological testing and legal and ethical issues in school psychology. In addition to test anxiety, he also researches the assessment of learning and attention problems, the provision of testing accommodations to students with disabilities. He has over 100 publications on these and related topics, as well as 4 books, most recent one being Overcoming Test Anxiety.
And we'd love to hear from you all as you listen to this episode. If there's thoughts you have, join us on social media. We'd love for you to share.
With that, we hope you enjoy this Masters in Practice episode, Overcoming Test Anxiety.
Well, Ben, thanks so much for joining us on the Psych to Practice podcast. Paul and I have been really excited about having you join us today.
I'm delighted to be here. Thanks so much for the invitation.
Yeah, absolutely. It was, I'm excited to dive into your book a little bit because we had a chance to look at it. And any of us that work with kids or college students, test anxiety is not a new topic, but one that we're always looking for some ideas around. So really excited to get into this. And we like to start off kind of giving our audience a little bit of background of our guests. So, we kind of say we want to hear a little bit of your origin story. So tell us a little bit about how you got into psychology.
Sure. So I should say I'm trained as a school psychologist. And so I got interested in school psychology. I learned about the profession when I was about 16. My mother was a speech pathologist in the schools. And I got interested for reasons that are hard for me to understand myself in testing, psychological testing. I would see her scoring the tests that she gave as a speech pathologist. And she said, well, if you like testing, I know people who just give tests all day. And in Philadelphia in the 1990s, that was a typical role of a school psychologist. It's changed since then. That was common. So I followed around a couple of her colleagues who were school psychologists. And I thought, this seemed like enjoyable work. They were folks who got to work directly with kids. They worked with teachers quite a lot. I felt like I could do that. I felt like it was a good job. And so I began to look into school psychology more. And went to college and became a psych major, went to Penn State. Many of them also were psych majors, and some of them went to Penn State too, where they had a school psych program, although I wound up going to Syracuse for my master's and doctoral degrees in school psychology. And one of the reasons I chose Syracuse was I knew I wanted to teach. And Syracuse had lots of opportunities for graduate students to teach their own classes, which I really wanted more experience doing. And that was really how I first encountered test anxiety. I have much of a history of test anxiety myself, but teaching a class for the first time now over 20 years ago in educational psychology, I had students who were not doing as well as they wanted to, some of them on tests, and they attributed that to test anxiety. And I thought, I'm teaching a class on educational psychology. If I can't figure out what this test anxiety thing is, I shouldn't be doing this. And so I began to look more into testing anxiety. I wound up including test anxiety measures in my dissertation and other studies. And I became really interested in this issue of whether test anxiety directly impacts performance. Does it really keep someone from being able to show their skills? Does it lead to an unfair score? But at that time, I wasn't as interested in intervention work. And it was really when I became a full-time professor, I had many advisees and many students in my classes who reported high levels of anxiety around tests. And I started to give them advice informally and even do some exercises with them in my office at times around anxiety. And so then I got into test anxiety intervention more formally and anxiety-related therapy several years ago.
Wow. So what got you from that to now writing this book that, is kind of at the forefront right now? How did you get to that?
Sure. Yeah. It's, again, like so many things, not something I expected. It actually was during the early pandemic. I was working as a consulting psychologist with some schools. I would occasionally be asked to consult on case-related issues involving students' needs. And, a lot of the students were having anxiety as they were coming back in person from the pandemic. Sometimes the schools were in a hybrid format. Sometimes they were taking online tests. They were experiencing new kinds of test anxiety. And so I had continued to do research now and then on test anxiety, but I was asked to do some direct intervention work with high school students. And so I had missed it. I had not worked directly doing intervention work with high school students in a while. Yeah. I actually wound up doing some additional peer supervision just on some different kinds of techniques than what I had been used to, which was good for me, and wound up eventually writing a book.
Wow, okay.
Authoring a book with my co-author, Alex Jordan, on test anxiety. He's a psychotherapist who specializes in anxiety-related issues.
So this really did come out of direct clinical time, which is, as I read the book, that it makes sense because it really, it has that real practical feel of, something that came from the trenches, for lack of a better way to say it.
Yeah. I'm so glad that comes through. It really was, I don't want to say an accident, but it was something that was unexpected.
Right.
We couldn't find any resources on test anxiety. Alex, my co-author, was someone who had already been using acceptance-based behavior therapy quite a lot. I was familiar with it. I had a small amount of experience with it. And with some of the tools that we cover, like behavioral relaxation, I had much more experience with. But putting them together in a package and being able to present it along with all of the research on test anxiety was something we couldn't find having been done before.
Yeah. And you mentioned this idea of like this kind of came out of like COVID, which I feel like COVID unleashed anxiety in a whole bunch of different ways. And, and I definitely, my clinical work have, and I'm sure Paul has too, have seen, many kids who, the online education made testing harder, and then they finally got used to it. And then now we're back in the classroom and they have to relearn that again. So, we hear a lot about it, but I guess how prominent is test anxiety? Is it as common as it feels for us in the therapy room?
It's a great question. Because test anxiety is not listed as an official disorder, there's no threshold at which we say, oh, well, now it's clinical. Now you have a disorder. So if we ask more generally, how common are test anxiety symptoms? My own research with some of my colleagues has shown that about 99% of college students we did a large-scale survey of 3,000 college students, almost 3,000 at a large university. We found 99% of them reported having at least one symptom of test anxiety at least some of the time. So having some types of test anxiety, some test anxiety symptom is almost universal.
And I think that's such an important piece to kind of share and recognize, because there's such an isolating feeling when experiencing test anxiety. And like, there's also so much like this kind of like comparative aspect of, and really hearing that like, it's so prevalent, yet the experience of it is so isolating. And again, like kind of, I know we'll get into it more, but just kind of some of that, the impact of anxiety and really kind of the core elements of anxiety coming through where we're having some of these inaccurate perceptions and really having to, I think that's the value of the book, is being able to then give some specific interventions of how do we have to reframe this experience, and whether that's challenging it directly or even adjusting our perspective on it, and how do we can even utilize it in really hopefully making it a bit functional here. And I guess when you're talking about that 99%,
Mhm.
it does make me wonder who, if anyone, is at a higher risk for that experience, though. And so when we have it, such a large population that it
Mhm.
identifies it, who maybe experiences it more likely? Like, what are those predictors?
Sure, absolutely. If I can just take a step back to what you were saying at the beginning, though, psychoeducation around test anxiety has to start with its prevalence.
Mm.
So, as you say, test anxiety can feel very isolating by their nature. Internalizing symptoms are things you can't always see in someone else. And so, for someone who's experiencing anxiety about tests or anything else, their focus is on themselves and they are not aware that other people are feeling the same way necessarily. So, a big part of our first module in the book, psychoeducation, which is always what I start with, and for some students, that's enough. Psychoeducation
Yeah.
is telling them about that prevalence and normalizing that experience. But as you imply, it's not as though it's an equal opportunity experience in every sense. It's not as though all groups, subgroups have the same level of test anxiety. On average, we do tend to find differences. Probably the biggest demographic predictors of test anxiety levels are gender and disability status. So we see substantial, consistent evidence for a gender difference in test anxiety. Girls have a higher level of test anxiety on average than boys. Women have a higher level of test anxiety on average than men do. And so we see that across decades of research. There are obviously a lot of men with high levels of test anxiety. There are certainly women with low levels, but we see that consistent difference on average. In terms of disability status, I'm really talking about things like learning disabilities, ADHD, and other sorts of psychological problems. And so any of those conditions put someone at higher risk for test anxiety, or on average, they're going to have a higher level. Again, varies from person to person, but on average, you're going to see higher levels. There's a smaller amount of research looking at race and ethnicity as predictors. There's a small amount of research suggesting that there might be slightly higher levels in individuals who are Black or Hispanic compared to white individuals. We don't have as much work on Asian individuals, but we see small differences occasionally in research, but much better research on gender.
And it makes me curious, kind of in that plethora of research identifying those gender differences, has there been any exploration of kind of where that's coming from or kind of why we're
Yeah,
seeing that happen?
sure. It's interesting. So when you control for general gender differences in anxiety, when you control for the fact that women have higher levels of anxiety disorders than men generally, the difference in test anxiety vanishes. So it doesn't appear to be anything particularly about tests. It's really a more general difference in temperament, the personality trait that sometimes is called emotional stability or neuroticism. Neuroticism levels tend to be higher, again, on average in girls compared to boys, especially once you get to the teenage years and beyond. And so that's probably why we're seeing that higher rate of test anxiety. If anything, in educational settings, by the high school level, girls outperform boys. So it's not because of lower levels of skill. And there's also an important piece of kind of inference from that, which is like it doesn't appear to relate to performance in the way people expect it would. So if test anxiety actually prevented you from being able to participate in a test, from really being able to access the test or otherwise be involved, we would expect that girls would have substantially lower test scores than boys. And we don't see that at all.
I was going to say, I mean, sometimes we hear people make comments that sometimes anxiety can enhance performance, that there's at a certain level, there can be a little bit of a benefit. Maybe it makes us study harder or do more work or whatever. Do you find is that a true statement when we hear people say that, or is that just?
It's a good question. So, there are a lot of psychologists who will be familiar with the so-called Yerkes-Dodson law or the Yerkes-Dodson principle, which argues that there's an optimal level of physiological arousal for task performance, that if your body is really hyper-aroused, that's not good. You're going to be distracted. If you're at a really low level of arousal, you'll be bored or even sleepy. And so you have some sort of sweet spot in the middle where you have this optimal level of arousal. It probably is true on the edges of that dimension, where if you have really low levels, if you're falling asleep, you're not going to do well. And if you're in a state of abject panic, you may not do well either. Beyond that, we don't really have much research showing that there's a curvilinear, as we say, relationship, that there's an optimal performance level. And in fact, overall, the relationship between anxiety and performance is pretty weak. So for folks who are familiar with correlation coefficients, meta-analyses that average data from many studies find that overall the correlation is about negative zero point 0.2. So it's pretty modest. There's a slight relationship where folks who have high levels of test anxiety will do slightly worse on average. But even in those cases, it's not necessarily because of the anxiety. In fact, the few studies that control for people's performance in low stakes settings or for their background knowledge or study approaches, when those studies look at that, you don't see any relationship anymore between anxiety and performance. So it seems as though, to the degree that anxiety affects performance, it does so indirectly by changing the way people prepare for tests, change the way sometimes they learn. There's some research showing, for instance, that people who have higher levels of test anxiety don't study efficiently. They may study for more time, but they don't test themselves when they study, and that's the most effective type of studying. So they find testing so aversive that they are more likely to reread their notes or copy notes or things like that that are not like taking the test. Then if they don't do so well, they blame the anxiety, and in a sense, they're right. But it's because the anxiety affected their study choices. And so as interventionists, we can change that.
And that's something, and I know I believe it's the second module of the book that really kind of focuses on the interventions. That was something that was so fascinating. And I know we'll kind of get to that point. There's a few other pieces maybe beforehand, but just the importance of how do we integrate and really develop a more effective study tool. And also, I believe kind of later on in the book, you describe different ways of reframing and the experience of the anxiety as well. There's that kind of the pre-anxiety and the post, or kind of the anxiety maybe after the test. If I'm remembering correct, was the statistic that pre-anxiety before the test anxiety, is that around 4% of significance, if I'm remembering correctly from the book?
Maybe that was based on like what percentage of variability in test scores were explained by anxiety. So there have been a couple studies on this. There haven't been a ton, but there have been a couple studies comparing whether measuring anxiety before the test predicts your test score better or measuring anxiety after the test predicts your score better. So if test anxiety were causing poor performance, your anxiety level right before the test should be what matters. The studies that have looked at this find the opposite. So your anxiety level after you take a test is a better predictor of your test score than your anxiety level before the test is predicting your test score. And to us, that suggests that it's more likely that actually your test performance causes the anxiety.
Yeah. And so there's more accurate reflection of like that anxiety being present or not is the more accurate reflection based off of how you're assessing the outcome then afterwards. Am I hearing that correct?
Exactly. Yeah. You have some sense of how you did on that test. And so that's going to lead you to feel more or less anxious. If you know you really nailed that test, you're going to feel less anxious. If you have a sense that for whatever reason you didn't do so well, maybe because you didn't study, maybe because math isn't your thing, whatever it may be, then you're going to be more anxious because you're thinking about the consequences of that test score.
And so I guess how does that then translate? So if the before the test anxiety really isn't all that accurate of a predictor, like one of the other things that I often hear with the test anxiety is this almost that sense of like mind going blank. And it's just like all my studying just can't access that. And so is there really any evidence to support that at all?
Another great question. If I had a nickel for every time that a student told me that, I've been teaching classes for many, many years. And I myself have the phenomenology. I have the experience, and probably so do you both, of sometimes feeling like you're in a state of anxiety and you can't do something, you can't think of something, a word that can't come to mind, things like that. So we can all resonate with that experience, but the available research doesn't suggest that it holds up. Basically, the studies where they've done things like bring in students after an exam is over, when the stakes are gone, there's no more high stakes there, and orally ask students some questions about the material. They can't recall things that they also couldn't recall during the test. Students often have poor metacognition, as we say. They may misjudge their knowledge of the material, particularly when they study using things like rereading their notes or copying notes. These are not effective strategies for recall, but they help students feel like they know the information. The more times that you read over your notes, the more you feel like you have them inside of you, and you don't really. It's not until you force yourself to do retrieval practice, as we say, practice recalling it from memory, that you do. So students get this illusion of, really having mastered the material if they're using superficial study strategies. Then when they get to the exam, they can't recall things, they're feeling anxiety, and they say, my mind went blank. But there was it was never filled to begin with. They hadn't studied the right way.
Yeah. So I want to maybe go a little off topic, but yeah, I know you do a lot of work around accommodations as well in your research. And, one of the things, before we started recording, we talked a little bit about us talking about accommodations. And one of the things I see on every IEP and every 504 plan and every accommodation is extended time. And, with anxiety, I always wonder, are we just putting that because it sounds good, or is that a benefit for people with anxiety? What's your experience with that?
Sure. In the short term, extended testing time certainly can reduce someone's anxiety. So we do know that time pressure is a significant source of testing anxiety for many students. So giving extended time can certainly reduce that in the short term, but accommodations are more generally not something that we generally want to do for anxiety. And if anxiety is not actually preventing performance, then they're not actually needed. It simply is making someone sort of feel more comfortable in the moment, but it's letting them think they need something that they don't. And it can actually convey a message that we don't want to send, which is that you're not capable of doing things. So, when I really enjoyed your episode on accommodations, and certainly commend that to listeners as well, I was really struck when I was listening to it about you guys were very open about how there's this kind of negotiation that's going on for many of us as practitioners when we're working with someone who's seeking accommodations. We're trying to figure out what's best. We're trying to figure out what the person needs. We know some accommodations can backfire. But there's a little kind of dance that we're doing, right? When we're trying to kind of figure out, how would you feel about this?
Right.
Do you really think you need this? And when someone's anxious, whether it's a state or a trait, you underestimate yourself, right? When we're feeling anxiety, we think, I can't do this. I'm not capable of this. And accommodations really reinforce that message, which is often not accurate. And so, we do have research showing that in the long run, accommodations tend to actually increase anxiety and interfere with effective treatment for anxiety. There's a lot of research on family accommodation, as it's called, for anxiety. When parents of a child with anxiety do things to reduce the child's anxiety in the moment, like a child who has a phobia of dogs, you get rid of the family dog, or, don't visit relatives who have one, or cross the street when you see one. That actually will in the moment reduce the child's anxiety, but in the long run, it tends to increase it. And the same thing is true for educational accommodations when they are being used to promote avoidance. So the very same accommodations that may be entirely appropriate in other situations. You have a student who has a reading disorder. They have very weak reading fluency. They're not able to get to many of the test items. And so providing them extended time may be entirely appropriate. But the extended time isn't going to make the reading disability worse in the long run. In the case of anxiety, it actually can.
Wow. That's such an important piece to consider there. Like, especially, again, talking to clinicians and practitioners who are able to provide those, whether it's recommendations or actually writing the accommodations, because there is that almost immediacy that's being sought in that moment. And it is really trying to pull back and say, short term, yes, this feels better, but it doesn't help. And so it is trying to really identify, like, how are we defining what better is? And better isn't feeling progressing and growing, developing skills.
Absolutely. So, we're always trying to think about our clients' long-term autonomy, independence, those sorts of things. And there are times when accommodations really enable that, which is great. And there are other times when they can actually impede that development. And when we have research showing that when folks have anxiety during a test, it doesn't prevent them generally from being able to participate in the test. Providing an accommodation suggests that it does prevent them from participating in a test, and that's just not accurate. In rare cases, there may be folks where there's evidence of this, but the research tells us our default expectation should be that an accommodation is not needed.
Absolutely. And you mentioned something earlier, it just the way that test anxiety does tend to impact is in those like preparation pieces and really kind of engaging in some of those like the most effective study methods. And again, from the book, I know that was one of the major areas that was covered, but I'm hoping, can we also go in a little bit like, what are the other ways, especially in that preparation way, that we see test anxiety impacting the preparation side?
Sure, absolutely. So at the largest scale, in the most extreme form, test anxiety leads to avoidance of tests and even avoidance of classes and sometimes majors or degrees or whole fields. So it's not unusual for a student to switch from pre-med to English or something like that because they don't like tests. This happens more than I expected when I began to do more work with test anxiety in clients who have it. So the consequences can really be quite severe of test anxiety, but it's really influenced by people's behavioral choices. And I totally get why you wouldn't want to, be a student in pre-med if you have to take lots of tests and you hate everyone. But it's a shame. You might be an excellent physician and you might actually be able to receive effective intervention for the test anxiety. So that would be in a really extreme way. Another thing that's much more common is procrastination. So obviously procrastination is something we all deal with, or most of us deal with. I certainly do. But when you're anxious and you're already wanting to avoid things, it can make procrastination much worse. So not only are you not looking forward to something, it's actually causing you distress. And so you're not going to study until the last minute. So test anxiety can lead to a lot of cramming, among other things, that we know is also just not good for long-term retrieval. So, test preparation in a variety of ways are affected. And also, I should say, we are seeing more and more high school students who have extreme levels of anxiety around tests and other things where the consequence is school avoidance. So I don't know about you all. I hear about this more and more, certainly from the schools I work with, from families as well.
Yeah, it's, and going back to, the study piece, you've mentioned, a few times the idea of really practicing retrieval. It's not about just reading over your notes. It's not, and it's, I have a college student daughter who is preparing for the LSAT for law school. And, one of the things is she's doing her prep. I think that's been so fantastic is all the programs that she uses. You're taking a practice test every day. It's not just about giving you the knowledge. It's, here are 10 questions. Okay, you did that a few times. Now we're going to give you a whole practice test for 2 hours. And the empowerment that has given her is so interesting. Like just the mindset of like the fact that she practiced it. And even if she maybe didn't do well on one, but the next one she got a percentage higher or 2% higher, like watching that confidence build is phenomenal. And doing it, like watching somebody do that, I was like, wow. Yeah. When you mentioned retrieval, I'm like, yeah, we miss that often. That's the piece we need. If you're going to lessen your anxiety when you're doing it, you just got to keep doing it.
Absolutely. These days, with many of the electronic study aids, they're wonderful because they will actually target your weaknesses and give you more practice with the things that you're getting wrong. Right. But if you have test anxiety in the initial phases, that's most unpleasant for you. And so, even the exposure, like all types of exposure, initially, it's not necessarily pleasant. So it's so important to start that process and for us to be kind of encouraging folks to do different sorts of retrieval practice if they're not doing so well on tests.
Yeah, I've seen that, and I'm sure you've kind of heard this, as a school psychologist myself, I have many students, math anxiety. So It's math is the one they struggle. And, the interesting part is then Khan Academy came out, right? Like, and all of a sudden Khan Academy, again, it shows you, but it's a retrieval. And I've seen kids who go, okay, I'm not that bad at math. Like, I just, it's maybe not my favorite, but they kind of that exposure in a very small way, not taking a 2-hour test, but hey, try 2 problems. Let's see if you can get that and then go.
No, it really is a behavioral orientation, right?
Yeah.
I mean, the way I like to put it is if you can make the correct response to the stimulus the day before the test, you can make the correct response to the stimulus the day of the test. For many years, I taught large undergraduate classes, and I would tell students, if you think the anxiety is what's preventing you from doing well, meet with me the day before the test. After you have studied, but meet with me before the test. Even if you've only studied half the material, meet with me about that. And I will see if you can answer questions about the material. You won't be graded or anything like that. We're happy to just sit down with you and ask you some questions. And if somehow you can get those right, I'm not giving you any cues. You're just replying the way you would have to during a test. And you cannot do it the next day on the test, we'll find some alternative way of measuring your knowledge. And in 20 years, I haven't seen it happen.
Wow.
Where someone can give the correct answers, when they're in my office, but somehow they can't do it on the test. And that's having, over the years, a small number of students who have pretty intense anxiety reactions. Like any longtime instructor, I've had, unfortunately, a few students who have, broken down crying during tests and things like that. I feel for them tremendously, but I don't see them as not being able to participate in the test. And I don't see the test as giving them an inaccurate score.
And going back to like the importance of the retrieval, especially and the value of practice testing, it comes back to also that first module of the psychoeducation, because if someone takes a practice test and they don't do great, that's such valuable information. But if you don't see it as valuable, you see it as a reflection of how you're going to do, you feel disheartened, and you end up again potentially engaging in the unhelpful practices. And I need to read over my notes more. I need to like go and reread this material.
Sure.
Versus being able to say, okay, wow, what a helpful tool, because now I know where to focus and hone in on. And even that reframing process there, because I know during my time in high school, and he was like, I would really really read into those practice test scores. Man, instead of really being able to reframe it and in reading through that, that's such an important piece of making it feel practical and actionable. And it is practice. It's not let's take this pressure out of it, because then we can really get the most out of the experience there. And I hear that coming across in the book.
Absolutely. No, I mean, at the very least, at the high school level and often at the college level, people should have a growth mindset default assumption that they are able to master the material. And so, as you say, when they get initial feedback that they're not doing so well, that's valuable feedback. That's important information that what they're doing right now to study is not working. Alternative approaches are needed. But very often we can recommend ones that we're confident will be better.
And you kind of touched on this a little bit, but talking about maybe some of those other skills or kind of approaches taken, I believe kind of talking about the idea of a distributed practice as well as interleaving. And I'm curious for our audience, would you mind kind of going into those two and like kind of just sharing what those are?
Absolutely.
So important.
So retrieval practice is this general feature. I mean, the idea goes back arguably over 100 years to Thorndike, the psychologist who had studied the law of effect, as he put it, that if you practice doing something in a situation, you get some sort of consequence, you're going to keep doing that. And so, retrieval practice is very, very similar to very old ideas. But in the past century, we've learned a little bit more about what precise types of retrieval practice work best. So one we call distributed practice. So the idea is just if you have 4 hours to prepare for an exam, it's more effective to do it in 4 one-hour sessions than 1 4-hour session. So it's kind of the old rule that cramming doesn't work very well, particularly for long-term retention of material. So breaking up the time into smaller intervals is going to be more effective. Interleaving is an idea that if you're studying 2 topics, or even if you're preparing for 2 exams, it's better to interleave or mix the study periods where you're covering topic A and topic B, or studying for exam A and studying for exam B, instead of doing all of them in one sort of setting and then preparing for the second topic all in one setting. You want to mix up the material. That's one of the ways, again, that electronic study aids can be really helpful. They can give you randomized questions. And then, as I say, they can actually begin to remove the ones that you're consistently getting correct, so you can focus on the things that you really should be focused on. But definitely distributed practice and interleaving are just 2 kind of more advanced forms, I would say, of retrieval practice.
And as kind of hearing that, it sounds more challenging, more challenging to I have to do this over multiple days, or I have to put one down and pick up the other one. However, again, going into that growth mindset, that's kind of the point. You don't want it to necessarily be easy, because in that moment, if you can do it and we're kind of balancing back and forth, it's just strengthening that skill of being able to pull the information when it's relevant and being able to have, again, people being able to retrieve it when it's needed.
Absolutely. The cognitive scientists call it desirable difficulty. That's their term for it, because it really does improve learning and retention. So what I like to tell students is when you're studying for the test, you want to make it like you're taking the test. I'm not going to give you all of the items in the order we covered them in class. If you're just making up things from your notes and you're connecting them because we happen to cover 2 things on adjacent days, you're not going to do well on the test if you're relying on those superficial associations. You're going to have to respond to questions on different topics, because I'm trying to prepare you. You don't know when you're going to have to respond to different things. So, life doesn't happen in the same order that it was in a book. So in the very same way, you don't want to study that way, and my test won't be that way.
And within that, right now my mind is going blank, and this is kind of
it's not anxiety though.
It's not anxiety.
That's-
So, in talking about just like this improving our studying habits, the book also really talks about like this idea of like one challenging the idea of we're bad test takers, and almost conversely the idea of like how do we improve test wiseness? And is
Mhm.
that something like you kind of elaborate on both
Yeah,
of those, like this identity element, and then also like kind of going in like
sure.
test wiseness aspect
Yeah,
here?
so we have some research showing what I don't think is really surprising, which is that test anxiety is strongly related to an identity of being bad at taking tests. And this is something we hear from many students, many clients. It's as though test taking is unlike everything else in life. You're bad at taking tests. That's the thing you're bad at. It's not that you don't know the material, that you haven't mastered it, anything like that. It's the test is the problem. We don't have much evidence for that, but anxiety seems to cause that identity, that perception that people aren't really good at that. So, one thing that can help with that identity is what we call test wiseness. It's an idea that goes back, I think, to the 1960s. The idea is that people should get experience in taking tests. It's not that they're doing poorly because they're bad at tests per se, but it's helpful to be familiar with the format of a test to get used to it. So, this is why it's helpful to take practice tests in the same length, for instance, as the SAT, if you're going to take the SAT. If you are going to have to do it on a computer, then you would want to get experience using the computer software, because it's possible those factors could affect whether or not you're able to figure out what to do on the test day. So test wiseness is helpful. Sometimes test wiseness includes time management strategies. So this is something some students get training in naturally, other students don't. So if you have a test with a severe time limit, then you want to make sure to go through the items. If there's something you really don't know the answer to, don't spend time on it until you try the other items. Those sorts of things, mark the ones and then go back to them. So again, some students get this training by teachers or tutors, others don't. And so students really vary in their test wiseness by the time they get to high school and college. But those are helpful skills to know about. And that can also, as I say, affect someone's identity around being a bad test taker. If you are able to feel more confident, then you don't think of yourself as just being bad at tests.
We've talked about, I guess, kind of this indirectly, but we talked about the kind of practice tests. In our psychobabble, we use terms like exposure. So when we're talking about like the treatment, are the practice tests for test anxiety just an exposure exercise, or how do you define?
Yeah, it's a great question. So actually our behavior therapy approach uses a lot of exposure, but I really do think of practice testing as mainly working through making the student learn the material. So I would almost say when you have clients who have test anxiety, it's very crude, but you can sort them into kind of two groups. Folks who have a history of doing very well on tests. They're high achievers, they do extremely well, but they never stop being anxious. They keep thinking they're going to do poorly. They have a negative perception of tests, they hate the experience. But if you ask them, how did you do on last week's math test, et cetera, and you even look at the records, you see good performance. For those folks, they don't need the study strategies. So this is really why we made a modular treatment. We have treatment modules that are much more around exposure so that we can focus on reducing the anxiety. But the student already is doing well. They already apparently are studying properly, but they just really need anxiety reduction and anxiety management strategies. And for that, we really benefit from exposure. So we use certain strategies for exposure to the physiological symptoms of anxiety. And then we have some strategies for exposure to worries as well.
So can you kind of maybe give us an example of what would that one of those activities look like?
Absolutely. So just to start with the physiological symptoms, for many students who have physiological symptoms of test anxiety, their heart's racing, their stomach is churning, they feel very rigid and tense, those sorts of things. Standard behavioral relaxation treatments will work for many of those students. So that would be things like slowed breathing, 4-7-8 breathing. You inhale for 4 seconds, hold for 7, slowly release for 8 seconds. Many students do benefit from those. Similarly, muscle relaxation, been used since the 1960s, 70s as part of a standard behavior therapy regimen. And it actually goes back even earlier. That's something else that many students will benefit from. I also like that most of them haven't heard of it, whereas they've been told to take a deep breath for so long that some of them may roll their eyes or be skeptical about relaxation. So those are standard behavioral relaxation strategies. They work for many students. For those who feel the most intense panic symptoms during tests, they often need exposure to the symptoms in an environment where there's not a test or a threat. And for that, we use a set of strategies that was developed originally for panic disorder, interoceptive exposure, where we actually induce the panic symptoms in a situation where there's no danger. First, we do talk about the importance of exposure. If I'm working with high school students, I'll often ask them to guess how a mental health care person would treat someone who has a phobia of dogs. And they very quickly get to the idea of exposure.
Right.
You're going to have to get a dog in there at some point soon. And so once we agree that exposure is going to be necessary, often students will say, particularly college students, well, look, I've been exposed hundreds of times. It hasn't worked. I've taken a lot of tests. And, they're smart. They're thinking about this. And they have a point. So it appears that for exposure to be effective, there can't be actual threat going on. And so what's helpful is to induce those panic symptoms in session when you're working as a therapist with the client, when there's no test and there's no threatening stimulus present. So the technique I use the most is hyperventilation together with the client, or if I'm doing a group, all of us together will breathe deeply but rapidly for a minute. And very reliably, this will induce some of those physiological symptoms. Your heart will start racing, your extremities will tingle. Some people even feel like they're having visual sensations that are unusual. So we do that even though we know there's no danger, there's no test, and we watch together as those symptoms naturally subside. And so that's something we practice, but then the student normally has to practice on their own, doing this every day until they can ignore those symptoms when they happen during a test and just get back to taking the test. The problem with those symptoms during a test is often students shut down. Again, it's not the symptoms themselves. The student is so distracted by them, they start focusing on the symptoms and they're no longer working on the test. So we need them to get back to the test. We have to get them used to how you can work when you're having those symptoms, or you can wait a minute, they're going to go away naturally. Panic symptoms peak and begin to decline. And so that's something for the vast majority of students. If they don't have any medical problems that would be contraindications, we can use those strategies.
And I think that's such a valuable piece to the book is I think that, I think from a novice clinician standpoint, we just think about preparing them for the test. And I love the fact of taking the idea of the test away and defining it as anxiety. Like at the root, that's what we're really working on. The test is just stimulus. It's just something but getting to that you can be empowered to manage the symptoms in the moment. Then the test really, I don't say it doesn't matter, but in some ways, maybe in some ways it doesn't. They're more in the control of the symptom itself.
And at the very least, the students do begin to apply these strategies in other domains in life, which is great. But for the students who, again, are doing well on tests, they don't need the study strategies so much. They need these anxiety reduction and anxiety management modules. If a student's actually not doing well on tests and they're anxious, then we really need both types of strategies. We need the anxiety issues, and we need to also address the studying and test preparation.
And really, is that kind of the basis of the multi-tiered system of support that gets talked about and like the tier 1, tier 2, tier 3? Because as we're talking, like that's really what's coming to mind. Are we going to talk about the same thing here?
Yeah, so I would say it's not quite the same thing, but it's a related idea, which is, in school psychology, we talk a lot these days about multi-tiered systems of support. An earlier term that was really common was response to intervention. And so you hear the acronyms for those, MTSS and RTI, a lot in school psychology. Really, these ideas originated with saying, why don't we try to intervene and address problems before they get to the point that they're a disorder, that they're a disability that we would formally label. And so these sorts of multi-tiered systems start with what we call tier 1, universal strategies or universal interventions, things we can do preventively for everyone. So in the case of test anxiety, for me, that's really psychoeducation. Students should know that if they're experiencing anxiety symptoms around tests, they're not unusual. There's nothing wrong with experiencing those symptoms, and those symptoms alone won't cause them to do poorly or worse than they would otherwise do. So that's the sort of information that should be out there in the drinking water, as we say. That's the way tier 1 strategies are. The same way we put fluoride in the water, we want to put accurate information about anxiety symptoms out there for everyone to know. Tier 2, we usually think of as small group interventions for people who are at higher risk risk for a disorder. So that may be students who either have experienced a lot of test failure or who have general anxiety related problems. And so we're thinking they may need some more intensive supports. And then we think of tier 3 often as the most intensive individualized supports and interventions. And so those are things that, school counselors, school psychologists, or private practice folks in mental health care can do when someone has more severe symptoms. And they may qualify for a disorder label. Many students with generalized anxiety disorder will also have test anxiety, for instance.
Yeah, as I was reading the book, the idea of the tier interventions, I think was important. And one of the pieces for me is as a person who's worked in schools, I don't think we talk enough about test anxiety as a general piece. I was just telling my daughter this. I said, I actually never even heard terms like test anxiety until I got to college. And then I had to take this like intro to being a college student. It was like, this kind of onboarding. And all of a sudden, like I heard people saying like, okay, here's how you can study better. Here, yes, you're going to be anxious because you're going to take tests at a different level. And I always have thought in my career, like we should be teaching this when they're really young. We should be really preparing because, throughout our life, we have ways that we're being tested, whether it's a multiple choice test or not. There's that piece. And I don't know that we do that prevention piece enough in my experience.
No, I very much agree and really appreciate that. I think there's been a lot of push in the past few decades to actually train teachers in alternatives to formal tests, which is great. Teachers should know about assessment strategies other than sitting and taking a test, and that's wonderful. But it's almost as though we've neglected how to do testing right. Because tests remain in schools. There are alternative strategies, but they remain the backbone of ensuring that individual students know what they need to and can do things. And often teachers get very little training in assessment issues. Just on that point, I do trainings for some teachers in school districts, schools on this point, but often teachers don't know how to make a test. And a big source of children's anxiety, students' anxiety, is bad tests. There's test anxiety, and then there's what I call test anger. I've had clients take out tests to show me during sessions. It's difficult if I'm working with the school and I can't really say, that test I don't know about. There's a lot of suboptimal tests. Teachers are under a lot of pressure. They are often trying to make up tests without a great deal of training. Some of them make great exams, others less so. And so, that can be a big source of anxiety for students.
To kind of add on that, I'm just curious, like when you do have a situation where maybe there are bad tests, we know they exist. How might you approach that with a student? Like, because you said, you probably can't go to the school and say, these are really bad tests.
Absolutely. I take the tests that they're getting as a given. I can acknowledge that it would have been clearer perhaps to put something this way. Or I can acknowledge a typo, which can induce panic in someone when they see something they're not sure what to do with. So we can talk about strategies that the student can use in the moment, like going up and asking the teacher a question, which is something that they may not do otherwise. The anxiety might actually inhibit them from doing that. Some students go in different directions on that, but for some, they actually are paralyzed. They're not going to go and talk to the teacher. So we can talk about that, but we take the tests that they're given as like, that's the way they are. So what can you do with that? And so in addition to study strategies, the final module in our therapy program is really test-taking strategies. So sometimes that includes something as simple as reading all of the directions from the beginning carefully. Sometimes when students are confused by a test, yes, the test is not written as clearly as it could be because the test maker, the teacher, doesn't put reminders in of something. But training someone to go back to the directions, go back to the start of that portion of the test where there are general instructions and information. Sometimes students skip over those because they're feeling time pressure, but we talk about how important that is. There are times when I use a sample test in therapy and we talk about the process of how would you do this? What are the things that you would remember to do in a certain order? It really depends on the client. I've had clients where, for instance, they don't check their work because they want to escape the situation. I've had clients who are exactly in the opposite situation where they feel like they have to compulsively go through their test over and over again. So we kind of talk about test taking in the right way, and often that involves shifting the way they're doing it.
Am I remembering also one of those strategies surrounding that is really trying to interpret the question as the test writer or like as like the teacher intended. And so if we're kind of reading it and it feels confusing, if we can almost view it as that, like, okay, what I know about my professor, what I know about my teacher, how do I think they wrote this? Or how do I think that they intended, what do I think they intended with this question versus maybe how I'm reading it and interpreting that?
I'll sometimes suggest that students basically hear the item in their teacher's voice as though the teacher's just asking them. And so they're having a sort of conversation, if you will, but they can begin to get into that mindset. They think about what else they know about that topic, the things that are mentioned in the item, and things become clearer. Just myself as an instructor for many years and a test maker, I tell students that on my items, I try to write them so that if you know the material, it is clear. But if you haven't prepared, if you haven't studied, you shouldn't be able to figure it out. So I always warn students, if you are having trouble with a particular item and you're anxious about it, it may just mean you don't know that particular piece of information that's in there. It's not a reason to panic, but it may be confusing to you just because you don't know that one. Go on to the next one. Go back to it when you can. The key thing is knowing what to do in that moment so that you don't shut down. And many students who have severe test anxiety tend to shut down during tests and don't actually use their time well.
So as we're kind of, maybe wrapping up here, I guess, are there any other kind of pointers that you would kind of maybe say that as treating therapists, we should kind of think about when we're working with testings?
So, I think of the root that we try to emphasize in the book in acceptance-based therapy generally is to emphasize that students should not be afraid of their anxiety. They shouldn't have any secondary reactions that are bad emotions to their anxiety, that it's entirely normal. To me, I want to emphasize that over and over again, and that the anxiety will not by itself cause you to do poorly. I can't tell you how you're going to do on the exam unless I meet with you the day before and I'm the teacher.
Right.
As a therapist, I can't tell you how you're going to do. And addressing that intolerance of uncertainty is something that we do in therapy. Intolerance of uncertainty, I mean. So that's something we can address. But the key thing is, even though I can't tell you how you're going to do on the test, I can tell you how you should take it. We can discuss how you should feel. And if you feel anxious, we can discuss how you should react to that. The anxiety is not itself something that should cause you distress. And that's, I would say, sort of the core message of acceptance-based therapy.
Yeah, that's great. So we like to kind of wrap up with kind of two questions with our guests. And one is, we're always interested if there's maybe a piece of media, whether that be a book or a podcast or something that you would suggest to listeners as something maybe that would be something they should check out. Anything come to mind that you could share?
Sure. If I'm allowed to, for folks who don't have much training in acceptance-based therapy, whether it's a client or a listener who's a clinician, I would recommend actually starting with some of the self-help books like Get Out of Your Mind and Into Your Life, getting a kind of background in that therapy. That's one of the books that I often recommend about that. So that would be on sort of that end of things with regard to, like, if acceptance-based behavior therapy is something that's helpful. Let's see, I had a second one and now my mind is thinking, there are definitely also good books, I would say, on learning and retrieval practice, things like that. Make It Stick is one of the books that comes to mind there. So I would say kind of learning about those two things, I would say.
Great. And then kind of the last question is, we always like to have our guests give 3 takeaways to kind of wrap up. What would your 3 takeaways be for our listeners?
Yeah, so I would say, number one, test anxiety will not keep you from doing well. It's not the anxiety. Number 2, poor studying, poor preparation can keep you from doing well. So there are better ways to study if you're not doing well. And I guess for the third, I would say accommodations can be dangerous. And that actually reminds me, what I had intended from the second resource to recommend is the work of Ellie Leibowitz, who's a psychologist at Yale University. Yeah. He's written a couple books on accommodation of anxiety. One of them is a book for parents. Another is a book for professionals. But everything he says about family accommodation applies to schools and testing situations as well.
Yeah, that's a great recommendation. I've read some of that work and it's fantastic. Wonderful. Well, Ben, this was fantastic. I mean, so much information and really loved reading the book. Although I'm beyond my test taking phase, at least I think, for the moment. Really, it's such a great resource. And I've already kind of put some of this in play with people that I see. So I really appreciate what
No.
you all did on this book. Was really great. And thanks for joining us.
Thank you so much. It's always really gratifying to hear from someone who's found it useful as a clinician, and really appreciate it.
Just to echo that again, thank you so much, Ben. And actually, for our audience, wanting to see like if they're interested in following along with your work or kind of checking out, like staying up to date, is there anywhere they can go to follow you?
Sure. I have a website, benlovettphd.com, and people are free to check out that. Occasionally I post something there, and I definitely have updates if there's any new books or anything like that. From there, I also have a link to websites that have my scholarly information if people are interested in seeing journal articles on the topic. And I have a lot on accommodations and even some publications on test anxiety.
Certainly hoping they check that out. And also, for you listening at home, please check the show notes. There'll be a link for Ben's book here, Overcoming Test Anxiety. And if you're a licensed clinician who would like to use this information, please head over to psych2practice.com or check out our show notes. And we will, at some point here soon, be posting links for an accompanying exam for continuing education credit for this episode. If you're interested in hearing more or staying up to date with what's going on for Psych2Practice, visit our website or follow us on all major social media by searching Psych2Practice. We'll be back in 2 weeks, but until then, be well, stay psyched.